This calls to order the Monday, May 10th, 2021 Boulder County Board of Health regular meeting. Can I have the board members introduce themselves? I'll go first. Greg Thomas, Board President.
Hello, this is Jorge de Santiago, Vice President.
Hi, this is Landry Fagan, Board Member.
Hello, everyone. And Brooke.
I have Brooke Harrison, Board Member. Can you all hear me?
We started a little faint, but got a little louder. So maybe
Okay.
put the mic closer if you are adjusting that. Okay. All right. So we do have a quorum. Lexi, I think you're on the call. Do you want to introduce the staff?
Good evening. Thank you, Greg. Yes, Lexi Nolan, Acting Executive Director, Boulder County Public Health. And tonight from our agency, we have Susan Hyatt, Marielle Barron, Kelly Hinch, Melinda Morris, Kate Haywood from the County Attorney's Office is with us, Tammy Golden, Allison Bailey, Rita Mangan, Audrey Shore, Heather Crate, and Lane Drager.
Good attendance tonight. Thank you, everyone. Okay, so let's see. We do have a quorum. So this regular meeting of the Boulder County Board of Health has been called to order at the discretion of Interim Public Health Director Lexi Nolan. Notice of this meeting was posted on the Board of Health's website as required by law and included the teleconference phone number and conference ID number so members of the public can participate in the meeting. Due to the current COVID-19 pandemic and the need for social distancing and compliance with the public health order, this meeting is being held telephonically as authorized by the Boulder County Board of Health bylaws. Okay, and agenda is item 1 is public comments. Are there any people on the call wishing to make public comment on any item not on tonight's agenda? Checking the chat. And it doesn't look like I hear or see any requests for public comment. So we will move on to item 2, approval of the April 12th, 2021 regular meeting minutes.
This is Brooke. I move to approve the minutes from April 12th, 2021.
This is Jorge, second.
All in favor? Aye.
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 Okay. Now on to item 3, presentation of 2019 Financial Audit Report.
Marielle, would you like to introduce the item and our guests this evening?
Hi, sorry. Susan Hyatt was gonna do that, but I will
Thank
jump
you.
in. And hopefully my camera wasn't even off. Sorry about that. So good evening, everyone. Mary Barron, Interim Director of Finance and Administration, and we have Sam Hillwich here, who is going to present the Bcph audit for 2019. Thank you.
Thank you, and good evening, everybody. Hope everyone's having a good day, albeit a snowy one here in middle of May. I'm happy to present the 2019 financial audit. We completed the audit earlier this year in January 2021 is when we issued it. Just wanted to say thank you to the entire staff that we were working with, Susan, Melissa Golden, primarily, as we understood that COVID-19 had significant impacts to Boulder County Public Health and continues to this day. So just wanted to echo our appreciation for all of their efforts throughout the process. We understand it was incredibly challenging. We did the entire audit in a remote capacity, and we probably are going to expect to do the same thing coming up here on the upcoming 2020 audit. We have that scheduled with Susan and Marielle currently slated for a couple weeks from now. So we're excited to meet back with the team and get going. So I'm going to present my screen real quick. And hopefully everyone can see it as long as I click the right screen. All right. So this is the independent auditor's report from the 2019 financial statements. The full financial statements here were issued about 60 pages long. And page 3 is where we get into the independent auditor's report. This is where, this is what we are hired for. This is what we report to you guys as the board and deliver our report to ensure that in all material respects, the financial statements as of December 31st, 2019 and 2018 and the related notes to the financial statements were accurate in all material respects. So just wanted to highlight a couple of these main paragraphs in here. First of all, management's responsibility for the financial statements, and management is responsible for the preparation and fair presentation of those financial statements. It also covers internal controls and having that adequate internal control environment between its various personnel and all the transactions that go on throughout the course of a year. So that is management's responsibility. Us as auditors, our responsibility is to express an opinion on the financial statements and the balances that are provided to us. We do this by obtaining sufficient and appropriate audit evidence in order to provide such an opinion. We do this through US GAAP and review of the financial statements in accordance with those standards that are required to be audited upon. So down here, we just note that over the course of our audit and working with Susan and Melissa and the whole Boulder County team, we have obtained appropriate audit evidence to come to a conclusion for those audit opinions. In our opinions paragraph, this is what everyone wants to hear, is that we have issued an unmodified or clean opinion for 2019 and 2018. Other matters, when we discuss the required supplementary information, there are certain aspects of the report, such as the management discussion and analysis, various schedules related to pension and other post-employment benefits that are part of required supplementary information that are part of the financial statements, but they're not part of the basic financial statements. So that can get kind of convoluted, but in a sense, what this information, it tags along in the financial statements that we help compile, but we do not provide any opinion on it. It is subject to certain audit procedures, but it is not part of the general basic financial statements that's subject to our opinion. And finally, we have a paragraph about other information. This is specific to the schedule of revenues and expenditures by function for the general fund. That is later on in this document, and that is the responsibility of management as well. But since that is subject and it's part of the underlying information that is part of the basic financial statements, that is subject to our audit opinion. So with that, it comes down here and it says in our audit opinion, it's another clean opinion that there was that information in this schedule was fairly presented in all material respects. So with that, that is, I apologize. One more paragraph too that I wanted to highlight here. In the back of this, in the financial statements, probably towards 58, 59 page, there are other reporting requirements in accordance with government auditing standards. This is related to the internal control type of environment and any issues that we discovered or uncovered as a part of our audit. We noted no significant deficiencies, no material weaknesses as part of our audit. So this is another way of saying another report that will highlight a clean audit opinion, no significant difficulties encountered during the audit, working with the staff, no significant material misstatements, anything of that nature. So with that, I'm going to pause and really open it up to any questions at this time.
Hi, Sam. This is Greg. So how did the, I mean, obviously we probably didn't, I think this is later than normal, right, for 2019. And that probably was because of COVID. And, but also I think, did the challenge of moving everything to Oracle, that whole accounting piece, did that present any challenges for your firm?
That's a great point. That also occurred in 2019, end of 2019. It did not present any challenges for us. There was a couple of extra procedures that we needed to do to make sure everything rolled forward from one fiscal year to the next. but we have a lot of experience working with Oracle. I believe it was a very user-friendly website. It just maybe took some extra time for the Boulder County staff to get up and running with that. I'm sure there was increased functionality to get used to there, and some of our documents that we requested in the past just had to be under a new language, kind of a new reporting request. So that was a little bit of a challenge, but overall, nothing significant. To your point, we did start I believe this audit started in May of last year. So similar timing for what we expect the 2020 audit. Okay. And I believe we probably tried starting earlier, but it was probably right in the mix of when things were obviously going awry. So
yeah. Okay. Great, thank you. Any other board questions? Okay, I don't see any. So do we need to, are we good? Do we need to go through any of the document to see any of the long-term projections, or are we?
Right, this was primarily just a presentation that material, everything materially agreed. So I think it's your guys' call for what's the next process, but given it goes all the way back to December 31st of 2019, the information probably isn't as up to date as you would like.
Okay, well, we'll load up for the 2021. How's that?
I like it.
Okay. Well, thank you very much, Sam.
Thank you.
Okay, so we are on to item 4, which is presentation on public health implications of high THC marijuana.
Thanks, Greg. And we have 2 staff members. I just do want to say before we move on, special thanks to Susan, Melissa, and our auditing team, along with Marielle. That was a lot of work for them in a very stressful time. And congratulations on a clean audit. In relation to high THC marijuana, I believe we have Allison Bailey and Audrey Shore here.
We do. Thanks so much for having us. Audrey has a presentation that she is going to share. So we'll give her a second to share her screen and then we'll get started. Great. Thanks, Audrey. So like Lexi said, my name is Allison Bailey. I use she, her, hers, and my colleague Audrey Schreier and I are here this evening to chat with you about the public health implications of high THC marijuana. We are both staff members in the Community Substance Abuse Prevention Program. I am the program manager for the program, and Audrey is our planner. And so just a quick rundown of what we'll go over this evening. We wanted to share with you some of the 2019 Healthy Kids Colorado survey data on marijuana use, and specifically some Healthy Kids Colorado survey data on the associations between marijuana use and some mental health indicators that Emily Payne, our epidemiologist, was able to run some really incredible analysis that shows some concern that we'd like to share with y'all. We also want to share with you a little bit about the Community Substance Abuse Prevention Program's current efforts. Wanted to alert you of some potential state legislation concerning this issue and share a little bit about some community concerns that we've been hearing. So to start off with the Healthy Kids Colorado survey that's administered every 2 years in Boulder Valley high schools. We've seen pretty consistently since the legalization of marijuana that the current use, so the students that report that they've used marijuana at least once in the past 30 days, has remained fairly consistent. So you can see those numbers between 2013 and 2019 is about the same, and we haven't seen a significant increase.
May I ask one real quick question?
Absolutely.
How does that differ from before legalization? Just curious.
So one thing with Healthy Kids Colorado surveys, they changed the methodology for the 2013 administration. So it's really challenging to do a direct connection between what was happening in 2011 and before with what was happening in 2013 and after. we can do a little bit of digging and see if there is something, but in terms of that exact graph just back a few years, that's not something that we're able to compare directly to.
Got it. Thank you.
So the one thing that we are seeing that is really concerning in the data, so though overall use has not increased, when we look a little bit closer at those current users, so those students that do report using marijuana in the past 30 days at least once, the methods that young people are using is changing. So in this graph, you'll see that the green bars are from 2015 Healthy Kids Colorado survey, the orange is from 2017, and the blue is from 2019. And that second group of bars right there is about dabbing. So we'll see smoking has gone a little bit down, but our dabbing numbers have significantly increased. So in 2015, 31% of students were current users reported dabbing, and in 2019, 60% of those students reported that they had dabbed. Our students who reported vaporizing or using an edible have been a little bit more variable, but it's really that increase in dabbing that we wanted to talk with you about this evening. I'm going to pass it to Audrey to share a little bit about why we're concerned about those numbers.
Yeah, thanks, Allison.
Audrey, I think you got muted again.
Thank you. Can you hear me now? Okay, awesome. Thank you. So we are just so we are all on the same page about what dabbing is. Dabbing involves inhaling small quantities of a concentrated and vaporized drug. And so in this instance, we're talking specifically about cannabis oil or resin. And the concentrates of cannabis oil or resin can contain very high levels of THC, which is the active component of marijuana that gets people high. And so concentrates can have around 60 to 90% THC compared to 5 to 15% THC in regular cannabis. And this creates risks of physical dependence and addiction increase with exposure to high concentrations of THC. And higher doses of THC are more likely to produce anxiety, agitation, paranoia, and psychosis. So when we look at the Healthy Kids Colorado survey, specifically among young people who dabbed in the past 30 days in Boulder County, we see that, we're looking at in this graph at young people who reported that they felt sad or hopeless in the past 2 weeks, according to the 2019 Healthy Kids Colorado survey for Boulder County. And we see some concerning associations with young people who are also dabbed in the past 30 days, and that youth who dabbed are significantly more likely to report feeling sad or hopeless. We also see that students who dab marijuana in the past 30 days are more likely to consider suicide than their peers who did not dab in the past 30 days. We see that students who dab marijuana are more likely to have made a plan to attempt suicide than their peers who did not dab marijuana in the past 30 days. And that students who dab marijuana are more likely to have attempted suicide than their peers that did not dab. And so these are very concerning associations. However, we cannot draw a causal relationship specifically from the Healthy Kids Colorado survey, since it's a point in time survey. And therefore, we can't draw a causation between poor mental health outcomes and young people dabbing, but we certainly see very clear ties between the two.
Can I ask a quick question in the do not use group?
Mm-hmm.
Does that include those that used marijuana but did not dab, or are those kids that entirely abstained?
I believe, actually, Allison, are you sure? I can certainly check and follow up, but I don't know off the top of my head.
I'm also not sure, but I believe it includes students who used marijuana with other methods, but we can triple check on that and get back to you.
So did use marijuana with other methods and abstained as well?
I believe so, but we will double check on it on this exact data point. Emily really drilled down for us to get to this one. And so I'm fairly certain that it excluded that the orange bar there is only those who reported dabbing, but we will triple check on that and we can get back to you.
Okay.
Yeah.
Thanks for the question.
Yeah.
Any other questions on the data pieces before we move on to the next part? Great. So the Community Substance Abuse Prevention Program wanted to share with you some of our current efforts. A large part of what we do is we convene community coalitions. So we have funding from the CDC Drug-Free Communities Grant and the Office of Behavioral Health with the state for our Healthy Futures Coalition and our Healthy Futures Youth Coalition. We funded from CDPHE for our Communities That Care Coalition. We also do a lot of work to elevate youth voice. So we utilize our grant funding to increase youth leadership and engage young people. We do some education primarily through providing technical assistance and training on substance use data. So we have done a lot of work around the Healthy Kids Colorado survey data presentation, sharing that with community members and general substance use prevention. Audrey just accepted the position as our project director for the SAMHSA grant, our SAMHSA Partnership for Success grant that we just received. That will be a 5-year process to utilize data to reduce substance use in Boulder County. And we also engage in local policy. Audrey and I specifically have been working a lot with our local municipalities around issues related to marijuana hospitality and delivery, and also alcohol. One restriction that the majority, well, all of our team except for me have, is that our grant funded staff are only able to engage in local policy efforts because we receive funding from the state. So we do a lot of education and work on that local policy, but in terms of being able to engage at the state level, our grant funded staff are not able to do that. And so one other piece that we wanted to share with you all tonight is that there's been talk since February of some potential state legislation being introduced to address some of the challenges of marijuana across the state. And so this bill has not been introduced. There was a draft that came out in February, and we had been hearing from some of our community partners that it would be introduced last week or potentially this week. So we're definitely keeping an eye on that, and we'll share that information with y'all when it's available. But some of the things that we may see and that have been talked about is capping those THC levels. The number that was thrown out in the potential legislation was 15%. And they were still working on what exactly that number is. But the issues that we're seeing in Boulder County around the impacts of high THC marijuana are mirrored across the state in different communities. And so there's talk of putting a cap on what that THC level would be. Additionally, not allowing marijuana to be dispensed through vending machines, having some additional labeling requirements, and then some additional tracking for medical marijuana. So something similar to a prescription that would be required to identify a therapeutic dose. As opposed to other medication that folks may use, when you receive a medical marijuana card, you are not given a specific dose like you would for another prescription drug. And there's also not a comparable program like the prescription drug monitoring program for medical marijuana. So there's very limited tracking on what medical marijuana looks like across the state to be able to really see who's accessing it, and really a big data gap as opposed to what we see with the prescription drugs. And additionally, it would require a toxicology report on autopsies of deaths by suicide, overdose, or accidental death, and then additional ER toxicology reports on any condition that may reflect marijuana use. One thing that we've been seeing is that there really is a data gap on what our community members are experiencing and what we're able to see in the data. So we have parents who are reporting that their young people are really struggling with having those mental health associations, having cannabis hyperemesis, which causes a lot of vomiting that is connected to cannabis use. But there's not enough data tracking to really know how often that's happening in our community and communities across the state. Similar with deaths by suicide, overdose, or accidental death, that at the moment it is the word of parents or some autopsies, doing that toxicology report, but it's not consistent. So there's some interest in having that be more consistent so we can have some more data to be able to know what the true impact is on our community. And to close out, wanting to share a little bit more of the community concerns that we've been hearing, that we've definitely been hearing from a lot of our parents and our community organizations who are working closely with parents and closely with young people on the impact of high THC marijuana. One of the things that we've been hearing a lot is the concern about that 18-year-olds are able to access a medical card, whereas to be able to access retail marijuana, you have to be 21 years old, but from the medical market, you only have to be 18. And so concerned that those 18-year-olds are still in high school or very connected to high schoolers and able to get access to product that then they could give or resell to folks in their peer group. We're also hearing from some of our local educators, the nurses in BVSD. This is a concern that they've shared with us. And also the Boulder Valley School District Board of Education passed a resolution a few months ago affirming their concern about high THC products in the community. We also had a conversation with Commissioner Lochimin about her concerns about the issue. She's also hearing from her constituents and parents and young people in the community about their concerns as well. Because of the high-profile nature of the bill that was talked about or that may be introduced, there was a lot of media coverage as well, and so that was another piece of why we wanted to come and speak with y'all, because it is something that we're hearing more, not only from our community members but also from members of the media around what is happening in Boulder County and some of the concerns around this issue. So that's the end of our formal presentation. Maybe Audrey, if you want to close out the presentation, let me see if anyone has any questions or thoughts as we wrap up.
I have a couple of other questions. So in addition to hearing concerns voiced against the high concentration THC, have you all heard much from any non-industry groups who would like to see the high content THC remain available?
The biggest constituent group with that is parents whose children use high THC marijuana medicinally. And yes, exactly. And I know that that was a big piece of feedback that when the bill was initially discussed, that they heard loud and clear. And so our understanding is that if a bill is to be introduced or there are to be additional steps taken, that would be taken into consideration. But absolutely, that is a group that is non-industry that has some concerns about what a cap might mean for their children.
And then a quick follow-up question. Have any other states instituted a THC cap, like in Washington or California? Or is the high concentration THC pretty much available across the board where it's legal?
I'm not aware of other states that have instituted a cap. However, I have heard, and I'm sorry, the specific states are slipping my mind, of other states that have recently passed legalization that are kind of in the formation process of what does that look like for their state, considering capping high THC or a THC amount at the start of legalization.
Got it. Thank you.
So how do, if concentrates, you said, I think at the beginning, are 60 to 90% THC, doesn't that kind of put the concentrates out of business? Or curious, how does 15% cap work?
I mean, yeah, so there are businesses that specifically create and sell marijuana concentrates, and I think that would be very challenging for their business model if there was a 15% cap on THC.
And I mean, the only ramification I see from that is, are you then going to encourage more people to smoke or burn marijuana. Because maybe that's one of the few products. But my understanding is, at least reading some of the lead up to this legislation, is that even marijuana flower can be as high as 25%, right?
Yeah, that is true.
I think it's also of note, and something we did not include in the slides, and is that among adult users, only about 20% report dabbing as within the past 30 days, compared to 60% of young people. So I think when we're talking about adult use cannabis, there is a preference differential between the method of use between those of adults and those of youth.
And that's from the 2019 survey. So did they have any kind of indication as to why high schoolers like to dab? Is it just the intensity and feeling invincible? I'm just curious why they would dab at such a high rate.
From what we've been hearing from our community members, is that it is an intense high, and something that is more attractive to young people, and also that because what we know about an adolescent brain and that thrill seeking and higher potential for addiction, that it is more likely that a young person who starts to dab would continue versus an adult. Anything else to add, Audrey, to that?
I don't believe so. We don't have much information around like access of dab being an easier method of use to access or anything like that. So I think what Allison said is just our best understanding.
One more question. So since the state legislation has not been brought into the Senate or the House, are you all hearing a lot of pressure for local legislation similar to like the flavored vaping legislation?
From our community partners and concerned parents, there's definitely a desire for there to be local action. I think the specific local action that could happen around high THC is really challenging, because it would be a product similar to the flavor ban, but if Boulder County was alone in that, then it would be a product where folks could really easily just go to the next town over, and especially with where we're talking about the folks who are accessing are 18 and above or 21 and above, versus with the flavor ban, you're thinking more of students who were much younger than that, being able to, from high school, being able to go to a gas station and access vapor products. And so I think we're definitely hearing that. We haven't heard a lot of great ways to do that. That's definitely something that we're investigating, and keeping our eye out if there are other local communities who've been able to do anything specific around the availability of high potency products. There's some conversation about looking at the medical card issue to see if the city of Boulder in particular could do some specific requirements for medical cards, and thinking about putting some more limits on the ability of 18-year-olds with 18 to 21-year-olds with a medical card to be able to access the amount of product that they're currently accessing. But that's just an idea that the Cannabis Licensing Advisory Board and the City of Boulder are sort of workshopping, and nothing that's moving forward at this point. But definitely interest in doing things locally, and just one of those things that's challenging to do on a local level.
Got it. Thank you.
Well, thank you for the presentation. It should be interesting to follow the legislation once it's introduced.
Definitely. We really appreciate your time and all your work. Thank you so much.
Okay, take care.
Take care.
Okay, item 5, update on current COVID-19 pandemic.
Okay, thank you all. I will provide a data update, a little bit of information on the case and vaccine trends, as well as how BCPH is responding. And then Kate Haywood is with us to ask for authorization to repeal a public health order that is rapidly becoming obsolete, which is good news. In terms of trends, our incidence of the COVID virus in Boulder County is now at 74.9, which is half the rate that it was when I presented to you last month, which is great news. Our positivity is now at 3.1%, which is improving from 5% last month. What's a little concerning still on this map of Colorado is that we do have a number of counties that are still in a red level, which is above 10% positivity. A lot of you who may be following the numbers may recognize that we're coming off of quite a high case rate over the last few weeks. We've had the second highest case rate in the country after Michigan. And we believe that that's due to a combination of factors, including the very transmissible B117 variant taking hold in Colorado before we were able to really get the distribution of vaccines rolling as much as we would have liked to.
Hey, Lexi.
Yes.
So on that chart, is some of the red in the rural counties related to, I mean, I would think this is everywhere, that testing demand is down. And so if you don't have as many people getting tested, or people that do get tested are not feeling well, and that's why they get tested, could that be contributing to the high percent positive?
Yes, and that's why you like to look at the case numbers along with it. So we are seeing high case numbers in some areas of Colorado still, particularly in counties that have low vaccination uptake rates. But you're absolutely right. A lot of times when you see high positivity rates, if it's related to low testing rates, then it could be a misrepresentation of the actual cases in the county.
Okay, thanks.
So our 7-day average of new cases is 42.9, and this graph gives you a little bit of our trend. So you can see that over the last few weeks, we've been a little higher than we wanted to be, but we are definitely declining, and we are anticipating that this decline will continue as the vaccinations continue to tick up. If you compare Boulder County in the red with our metro counties, you can see that we follow a similar pattern, but our cases are a bit lower. And we know that hospitalizations are a lagging indicator. So some of our nearby county hospitalization rates are continuing to increase. That's because the case rates have been high the last few weeks. What CDPHE and the School of Public Health's projections are indicating is that hospitalizations are going to peak around mid to late May, and then they'll begin to come back down again. This is a very optimistic slide, hopeful, I should say. We can see drops in cases across all of our municipalities. And we are also beginning to see declines that are also helping our inequities between white, Hispanic, Latinx, and other races. Case rates by age are continuing to decline. We're watching carefully the 0 to 9 and the 75 plus, which are the only two age groups that had increasing rates over the past week. All of our other age groups are declining. And if we look at vaccinations, we can see that across the metro counties, about 62% of our eligible population has been vaccinated. That number in Boulder County is actually, it's 69.5. I checked it just before our meeting tonight just to get the latest number, and it's actually 69.5 right now. So we are expecting to pass that 70% threshold, which is certainly a cause for celebration sometime this week. Unfortunately, our declines in vaccinations are, we're seeing a significant decline in vaccinations since about mid-April. So we're slowing down in our uptake. We are still getting about 2,500 vaccine doses per day in Boulder County. And just under half of our 20 to 29-year-olds are vaccinated. But what I'd really like to draw your attention to is that if you look at all of these numbers, we're really, we're at over 2/3 of our 30 to 70 plus population vaccinated, half of our 20 to 29-year-olds. And this number is a little bit deceiving, this 10 to 19 number, because there are still some ages in that group that are not eligible for vaccine. And if you do the math, it turns out that about of the kids that are eligible to receive the vaccine in the 10 to 19 group, about half of them haven't received at least one vaccination also. So that's great news. This is a breakout by race and ethnicity. We still have some work to do, particularly with the Hispanic and Latinx population, to make sure that they have the opportunities to get the vaccine, as well as with our African American population. And if we look at a geographic breakout, this map, if you'll recall, it's continuing to darken, which is good news. We still have our lower uptake areas on the east side of the county. I recognize that this brownish tan area is even lower uptake, but it's also a very low density area, geographic area of the county. So there aren't actually a lot of people in those areas. We are, as I've mentioned before, we continue to make sure that our clinics are located in places where that uptake is lower, and we also have significant numbers of feet on the ground through our influencer program, who are doing direct outreach to neighborhoods and communities with high social vulnerability index levels and low uptake levels. These are just a few of the clinics that we will continue to use as our kind of anchor clinics as we go forward. Because we've reached a point where we've seen kind of the bulk of the significant rapid uptake, what we're doing right now is we're really trying to focus in on what are our lasting and reliable clinics where people can know they can go and get a vaccine, and also be using communication tools and the outreach to really pull people into the clinics. And so Clinica, Salud, and Boulder Community Health are really our anchor clinics going forward. There are multiple locations. They are multiple times a week. They offer vaccines for a variety of ages, including the 12 to 15-year-olds who should be approved this week, and including bilingual staff on site and our community ambassadors who are in attendance at many of these clinics to make sure that it is a welcoming environment for them, for folks. These are some additional equity clinics that are related to, these are shorter term. They are kind of our state-sponsored equity clinics. They are not necessarily, they're doing smaller level clinics across the county. And then, of course, we've got, you know, a whole range of other providers, about 30 other providers. What we are planning for in July is that the hub in Longmont will become an additional site to offer clinics on Tuesdays and Thursdays after hours, and also on Saturdays. And there are additional state-approved equity clinics, including a series of clinics that have been approved to be sponsored by La Raza. And of course, we continue with our mobile clinics in partnership with a variety of folks to reach homebound individuals, to reach unhoused community members, and others who have trouble making it down to our anchor clinics. So for instance, being able to go up to Netherland or to Jamestown and other more mountainous remote towns. So moving forward, part of our messaging, this is all great news. You know, we've got a bulk of the community is now vaccinated. We are kind of moving into a different phase of the pandemic. We are also preparing for some additional policy changes as we go into level clear this weekend. But our messages are to ask people to please stay masked in indoor public facing areas. We did change our mask order last week to be in alignment with the state, which allows for allows for people to be unmasked outdoors and also in some indoor settings. We are asking for folks to keep protecting children. Part of our messages the last few weeks has really been, we were seeing big spikes in cases among children and in the schools, and we're really messaging out a lot with the newspaper and with our community reports to parents to please help keep kids masked, keep them safe, particularly in out of school settings, which is where we were seeing a lot of the transmission. That's really important, particularly because we don't know all of the long-term impacts of the COVID virus on children. And we are seeing some children who have symptoms that last long periods of time. And we've had 4 cases in Boulder County of multi-system inflammatory syndrome in children, which really causes a very painful, long ICU stay for those kids. So we really were asking folks to keep kids protected. We're seeing the rates go down now. That message seems to be getting through. And just we do have a few more weeks of school to get through. And then last, get vaccinated on for lots of different reasons. Some of them are to prevent the spread of the virus, to stay out of the hospital, to avoid long-term health impacts, but also so that we can all return to normal in terms of socializing, working, and traveling. I just wanted to show you this graph because this is the metric that would be used to prevent us from going into clear or from putting us from clear back into some of the distancing and restrictions. And what you'll see here is that if we reach this blue line here, that would be the level at which we would not be able to stay in clear. And you'll notice there's only been one occasion in which we've reached that blue line. That was back in November. So I think we're in good shape to be able to move to level clear as a county. However, because Colorado has had some higher case rates lately, there is some question still about whether the state may take action that might prevent us from wanting to move into level clear on Sunday. And so we're going to be watching that very closely, and we should have information back hopefully tomorrow about whether we're going to be able to move into level clear on Sunday or not. So in terms of public health orders, policies, and guidelines, we would like to request to remove the public health order on collegiate group homes this evening. You all know that we extended the mask public health order to keep it in place for indoors until early June. And in the meantime, we are also updating guidance on summer camps, fall return to school, how to use the vaccination variances that are allowed to get out of masking in some non-public facing indoor spaces, and then transitioning to level clear. Finally, I just wanted to wrap up with kind of what this all means for the agency in terms of our own transition. And I presented to you last month kind of this 3-phase vision of retain and stabilize, rest and recover, and re-energize and recommit. And this is just an update on those 3 phases. We are continuing to increase a higher level of communications, including weekly newsletters and biweekly all-staff meetings now. And externally, we're focusing on weekly public messages and increased outreach to mass media outlets. We are continuing to do quite a bit of hiring and onboarding. We are developing an agency recovery plan. that includes a number of different components that you can see here. We are continuing to provide staff support in areas of mental health, racial equity, pay equity, and equitable leadership. And we are working assiduously on our budgets, both to plan for the state funding for continued COVID response and also federal funding to fill gaps and restore the agency fully. In terms of rest and restore, we are planning to have an all-staff picnic in early June that I hope you'll be able to join us for. We will be anxiously awaiting the arrival and onboarding of our new executive director, respite for staff who need it, reflection and taking stock. We are beginning our plans for transition back to the office and in-person client support, and we'll be preparing for planning and assessing emerging public health needs. Phase 3 in August and September includes community recovery planning within the agency and county and with our community partners, as well as a broader initiative on community transformation planning that had started before the pandemic with the state and a variety of county partners across the state. So with that, I'm happy to answer questions on any of, I know that was a lot of information.
Good information and moving in the positive direction.
Absolutely.
Once we can get the hospitalizations to start decreasing. Hey, Lexi, I saw that the 12 to 15-year-olds were approved for Pfizer today. And I mean, I would assume that states will probably work pretty quickly to make that available here and in other states.
We're hoping it's going to be available here in Boulder County by the end of the week.
Okay. Good.
And BCH has the Pfizer vaccine, and any provider who has Pfizer should be able to provide it. It's going to be the same dose as the adult dose, so there's no dose change that needs to be done. So pharmacies that carry Pfizer should also be able to accommodate.
Great. Other questions from the board? And then, Lexi, I mean, are you pretty confident that, I know that they recently, the feds had issued the mask guidance on airplanes through September, and then, you know, the summer camp guidance. Do you, and then of course, then you had Dr. Fauci on this weekend saying that if we continue to kind of vaccinate, especially maybe as we get this next cohort of teenagers in there, that we'll start to see those overall percentages increase. You think there's going to be any change, or you think that's pretty solid when they make a directive like that far out?
I think we're going to see improvements going into the summer. And then, you know, we didn't do a good enough job really jumping on eradication of this disease early on. And so we're probably going to see annual surges in the fall that we'll have to deal with. It's part of the reason why we're working with the state already to get the guidelines in place for what schools should look like in the fall, anticipating that, you know, it's very likely that the virus will come back, and we just need to learn how to deal with it as a part of our lives now. The vaccinations have proven to be exceptionally effective. None of the almost none of the hospitalizations that we're seeing are among people who have been vaccinated, and none of the severe disease that we're seeing among hospitalizations are among people who've been vaccinated. If you've been vaccinated, you're really good to go. It's extremely protective, and it's proving to be also very protective for younger populations. So that's all great news.
Yeah, that'll be interesting when they get through analyzing the data. But I mean, it already seems like the you know, flu season of 2020, 2021 that never was, probably you could say because of the mask and the social distancing.
Yeah, and unfortunately, the flip side of that is that because we had such a weak flu season this year, there is some anticipation that it's going to be pretty significant next year. So we'll have to watch that one too.
Always got rain on my parade there.
Sorry about that. I wish I could tell you otherwise.
Keep your mask handy, people. All those fancy masks you've collected, they'll probably become a part of our lives here, at least on a seasonal basis. So, well, thank you.
So with that, I would like to turn it over to Kate Haywood to talk about the Boulder County Public Health Order 2020-09 regarding collegiate group homes in the city of Boulder.
Awesome, thanks Lexi. So this should hopefully be an easy one for you all. So just to step back in time, the Collegiate Group Home Order, that's amended Public Health Order 2020-09-1. It's been in effect since October 13th, 2020, and it remains in effect until repealed by the board. And as Lexi mentioned, staff are requesting that the board approve for this order to be repealed effective May 16th, 2021, consistent with Boulder County's move to level clear on the local dial. For some background, the Collegiate Group Home Order required all collegiate group homes in the city of Boulder, which was defined as any residence with 5 or more higher education students living in a group arrangement. Each one of those residences, there were about 35 or so in the city of Boulder, they were required to submit what we called a collegiate group home assessment to public health that included various measures and protocols related to mitigation, quarantine, and isolation at their facilities. Collegiate group homes were subject to a prior stay-at-home order and remained under that stay-at-home order until Bcph approved their assessment. The order remained in effect indefinitely, even after we collected all of the assessments, in order to continue requiring residents of these facilities to continue complying with the order and the measures and protocols included in their assessments. In addition to the ongoing compliance requirement, the order also requires on an ongoing basis weekly check-in meetings between group home residents and the city of Boulder, and so those have been ongoing. As you can imagine, circumstances have substantially changed since the order was issued in October 2020, warranting repeal of the order. Notably, graduation was on May 6th, marking the end of the spring semester. As a result, most students are moving out, and the collegiate group homes will have fewer and different occupants as compared to the school year. CU is also mandating COVID-19 vaccinations for students for the fall 2021 semester, which will reduce the risk of disease transmission in these residences. And by aligning the repeal date with the move to level clear, that will just help with facilitating public messaging by aligning the dates of those public health order changes. And happy to answer any questions.
And we are looking for a motion to authorize the repeal of that public health order.
Yeah, this is Brooke. So I move that we repeal Public Health Order 2020-09 regarding collegiate group homes in the city of Boulder.
This is Jorge. I second.
Okay, we have a motion and a second. All in favor? Aye.
Aye.
Okay, motion carries. Thank you.
Thank you.
And I just want to say congratulations to Kate, who recently got married. I think we all offer our congratulations to her.
Thank you so much. Had a week of marital bliss.
Wonderful.
Thanks, Kate. Okay, now we are on to item 6. Appointment of Camille Rodriguez as Boulder County Public Health Executive Director. I'm not exactly sure who's leading this one. Is that me?
I am happy to summarize Camille's qualifications and let you know that, well, I'll start with her qualifications. Camille has a JD in health law and a master's in health administration. She is currently the administrator in McLean County, Illinois, which is a county of about 169,000 people and is houses Illinois State University. Camille started in child malnutreatment and has a strong background in health policy and has worked quite a bit over the last few years in public health spaces. We're very excited about her coming on as the new executive director. She has agreed to begin June 7th if she is appointed as the executive director.
And for those board members who weren't in on any of the interviews, Tammy did send out earlier a long and short version of her bio. Also want to say thank you to staff and community panels. They had a fair amount of work in this process. And it was, really great to see the board support and great to see the interest and advocacy at the management level, the director level, and participation at the staff level. I think that was a pretty successful aspect of this whole process. And I think based on the feedback and the input that we heard, this is a good decision and the right decision. So thank you to everybody if you're on this call, and for those of you who aren't, and acknowledge board member Morgan McMillan. Morgan was actively championing much more inclusive involvement at all levels of the organization and with partners, and really had an interest in hearing from community partners about what things are really working well and what things might they like to see change. And so I feel really good with this process. Took a little longer than we thought, but you don't replace somebody in this position who's been here or who was here for 30 years, not necessarily all the time as the director, but very familiar face nonetheless. And so getting it right, taking your time and getting it right is more important than, just trying to get it done so that we could have had some overlap. I mean, I know Jeff will continue to support the organization. And so this should be hopefully a fairly seamless and very successful transition for Camille. So very happy with the outcome, and just wanted to express my appreciation to all of you. And Gianna Peterson, are you on the call?
Yes, I am here, yes.
And great big thanks to Jana and Mealy Dawson. They were great and really helping us figure out the best process for the recruitment, and then advising us along the way. And so, yeah, can't say thank you enough, Jana.
And I would just also extend that to our third-party recruiter, CPSHR, who was really incredibly helpful in getting you some great candidates to consider in the process.
Anything else from the board? Any comments before I'm assuming, are we doing a motion to appoint? Okay. So first I'll give the board members any opportunity to weigh in before we move on with that formality.
Just to mirror all the thank yous. It was a big help from everyone.
Yeah, this is Jorge. I really appreciate all the effort from everyone on the team, to the hiring committee and everyone's effort. Appreciate it. That was great.
Okay, so with that, do we have a motion to appoint Camille Rodriguez as the new Boulder County Public Health Executive Director?
Yes, this is Brooke, and I move to appoint Camille Rodriguez as Boulder County Public Health Executive Director.
This is Landry. I second.
Okay, all in favor? Aye.
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 That's unanimous. Thank you very much, everybody. Again, I think there was so much that went into this process from a design standpoint and an input standpoint from the staff. And I think when all is said and done, we really did apply those criteria pretty stringently. And it's perhaps why the process took a little bit longer than we thought. But yeah, this was fantastic. And I know I can learn something from it in my own endeavors outside. And so thank you very much. So Camille, just refresh, Camille will start June 7th, correct? Okay.
Yes.
All right.
And on behalf of the staff, I just want to say thank you also to the board for being so thoughtful about this process. And thanks also to Tammy for being our go-between and all of the support that she provided. We're very excited about this.
Yeah. Yeah, thank you, Tammy. I forgot to give you a shout out, but yeah, you had some heavy lifts there along the way.
Thank you very much.
Okay, now on to item 7, which is the director's report. I have to admit, I did not have time to read the director's report, so I do not have any questions.
I did
Not
not
hearing
have
any.
any questions either.
Okay. Okay, well, then we are on to old and new business. Does anybody have any announcements? And that includes you, Lexi.
I think I'm announced out for tonight. Thank you.
And I don't really have anything myself. So, going once, going twice. Okay. Well, that brings us to adjournment. It is now 6:39, and this regular monthly meeting is adjourned. Thank you, everyone.
Thank you all.
Thank you.